Welcome to Module 2 of the University of Nevada, Reno School of Medicine, Instructional Faculty Orientation. In this module, we will diagram the relationship between program competencies, course goals, student learning outcomes, and instructional objectives to give you a better idea of how our curriculum is designed. We'll give you a look at the program semester by semester to give you an idea of the coursework students will have completed when you join us in the classroom. We'll review the basic elements of adult learning theory and how it applies to training healthcare providers, and talk about strategies for delivering course content so that students are engaged and attentive throughout your lecture. Finally, we'll review the process of course content development for UNR Med PA and go over a few best practices for designing PowerPoint slides to ensure clarity and readability. The entirety of the PA program curriculum is carefully designed to ensure that all graduates acquire and demonstrate the knowledge, skills, behaviors, clinical reasoning, critical thinking, and problem-solving abilities required for PA practice. These program competencies are arranged into 7 specific, measurable domains, which include medical knowledge, communication and interpersonal skills, working within the health systems of Nevada, professionalism and practice, practice-based learning and improvement, systems-based practice, and of course, patient care. These competencies provide the scaffolding of the PA program curriculum. They also serve as the ruler by which we measure our program outcomes. The PA program curriculum is 25 months or 7 semesters in length. The first semester of the program includes the foundational sciences of anatomy and physiology and our basic sciences in clinical medicine course, which incorporates genetics, biochemistry, microbiology, and immunology. The first in the 4-course PA role development series explores the professional issues surrounding PA practice. Pathophysiology is introduced in the second semester. Topics in pathophysiology align on a weekly basis with the topics covered in clinical skills, which includes history taking and physical examination skills, and technical skills, which includes labs and diagnostics and technical procedures. Behavioral health and human development are introduced in this semester, as is the second course in the PA role development series. Spring semester continues with more advanced clinical reasoning and knowledge application in adult medicine, emergency medicine, pharmacology, clinical behavioral medicine, and technical skills 2. Similar to previous semesters, topics are aligned between courses. For example, when pulmonology is discussed in adult medicine, pulmonary emergencies, pulmonary skills, and pulmonary pharmacology are addressed in their respective courses to ensure reinforcement of learning. Spring semester also introduces the third installment of PA role development, which explores the social determinants of health and healthcare disparities. Finally, the last semester of the didactic curriculum is the second summer semester. Maternal child medicine is introduced, as is the final technical skills course. The investigative skills course teaches students to evaluate medical and scientific research and prepare students for the completion of their capstone project. Clinical skills 2 requires critical thinking, teamwork, knowledge application, and skills demonstration in the simulation lab as students work through patient cases in a simulated clinical environment. Finally, PA Role Development 4 explores patient safety, prevention of medical errors, and the legal aspects of PA licensure and regulation. The clinical phase of training is comprised of 8 4-week core clinical clerkships, 2 electives, and 2 primary care selectives. Students complete rotation-specific written examinations at the end of each clerkship, in addition to skills testing and standardized patient exams at callback days. The year concludes with a summative examination, a comprehensive examination required in order for students to graduate from the program and demonstrate the acquisition of the competencies required for PA practice. Let's review the competency domains for the program. As mentioned, students must demonstrate a program-defined level of competency in each of the 7 domains prior to graduation. This is accomplished by designing courses so that learning objectives and assessments teach and test students along a continuum of complexity from simple concept recall to higher-order clinical judgment and application tasks, such that by program completion, the successful students will have demonstrated competency in each domain. It's important to remember that competency as a new graduate is much different than the competence and expertise of an experienced practitioner. Students will, of course, continue to refine skills and expand their knowledge base as they enter practice and gain experience. One of the most important aspects of PA training is learning to recognize one's limits and knowledge gaps, a concept we thread throughout our curriculum. As stated earlier, instructional objectives serve as the roadmap for student learning. Learning objectives are statements that specify in measurable terms what students will be able to do when they complete a unit of instruction. An objective does not describe what the instructor will be doing, but instead the skills, knowledge, and attitudes that students are expected to develop as a result of the educational activity. They are specific, measurable student behaviors, which serve as the foundation upon which instruction is built. The purpose of objectives is not to restrict spontaneity or constrain the vision of education in a particular discipline, but to ensure that learning is focused. Think of objectives as a tool that students use to ensure that they meet the expected outcomes of a course or activity. They also serve as the scaffolding around which students should approach studying for the course. During curriculum and course development, careful attention is paid to the complexity of learning objectives to ensure that student learning follows a progression from lower-order tasks expected of a novice, such as basic recall and understanding, to those expected of an advanced learner, such as applying, analyzing, and evaluating. You may be familiar with Bloom's taxonomy, which categorizes tasks along this continuum from simple to complex. We expect students not only to be able to list, state, define, and describe concepts, but as they become more familiar with material and more mature as learners, we expect them to engage in higher order tasks such as appraising, investigating, synthesizing, and creating. You will see these types of verbs throughout the instructional objectives provided to you by the course director. Competencies, course goals, student learning outcomes, and instructional objectives nest together and help us to ensure that the curriculum is comprehensive and designed such that students receive a consistent, well-sequenced, and organized introduction to medicine, followed by increasingly rigorous learning and skill development. Ultimately, it is all designed to ensure that graduates are ready to enter the workforce following graduation and licensure. Students learn in a variety of ways, and adult learners engage with content differently than younger students. Adults bring life experience and knowledge to the learning environment. This experience and knowledge includes work-related, family, and community circumstances. Adults learn best when they can relate their new knowledge and information to previously learned knowledge, information, and experiences. In general, adults tend to prefer self-directed, autonomous learning. Throughout the program, we attempt to reinforce the importance of self-directed learning and inquiry so that students are prepared for the lifelong learning required by the practice of medicine. Adults want practical, goal-oriented, and problem-centered learning that can immediately help them deal with challenges. This is part of why bringing your clinical knowledge and experience into the classroom is so important. Students love to hear your clinical stories related to your experience with the topic you're teaching. This real-world experience helps them contextualize and apply concepts that will be relevant to them in the clinical environment. Adults are motivated to learn by a wide variety of factors. These may be personal aspirations, externally imposed expectations, internal desire or interest, growth and advancement, and service to others. This motivation is a large part of why they have worked so hard to become physician assistants. In order to create an engaging classroom experience, it's important to maintain an environment of active learning. The more we encourage and allow students to discuss concepts, apply knowledge, and practice skills, the more content they'll retain. No one enjoys a 3-hour droning lecture, so be sure to include opportunities for students to discuss topics, answer questions, and seek their own answers throughout your lecture. This can be as simple as stopping to work through a patient case, giving quiz or polling questions, or creating small, short, in-class team activities. The active learning experience breaks up the monotony of a long day of learning and leads to better retention and understanding of material. Most lecturers use some type of visual presentation media to outline key concepts and illustrate topics. PowerPoint tends to be the most common and is the simplest to use. Here are some best practices for ensuring that your PowerPoint slides are clear and provide just the right amount of content. First, don't put too much text on one slide. It's overwhelming for the audience, and they'll concentrate on reading rather than listening to you speak. Keep it simple. Avoid multiple slide transitions and animations. Listeners get bored very quickly if they have to endure slide after slide of animation. Use only high-quality graphics and avoid clip art and low-resolution images. Please cite sources for all of your images, including graphs. A very small line of text at the bottom of the slide is sufficient. We will provide you with the approved UNR Med PA slide presentation template. Any presentations submitted on other slide templates will be converted to our program template. To keep presentations ADA compliant, use one of the serif fonts such as Times New Roman or Georgia. Charts and graphs should be straightforward with readable text. Overcomplicated charts and graphs do not present your data well and are hard to read on screen. And finally, use bold text, underlining, italics, and colored text sparingly, and only to highlight key points. Keeping students engaged and actively learning can be a tough task in a curriculum as rigorous as that of the PA program. Some of the things that help students to remain attentive, absorb information, and stay engaged are easy to incorporate into your presentation. First, don't talk at your learners. Involve them by including cases and application questions in your presentation. Learners love anecdotes, but avoid confusing them with conflicting information like book learning versus this is how we really do it. Students will pick up the art of medicine in year 2 and will refine this during their first few years of practice as a new PA. Be sure to make eye contact with students. Use your slides as an outline only. And watch your students' body language. If they're slumping, staring into space, or actually sleeping, mix it up a bit. Change the pace, give them a quick assignment, break them into teams and ask them to research a topic. Randomly choose one team to present their findings, or ask individuals questions. This allows learners to discover data for themselves, and importantly, don't forget, it's not your job to answer every single question they ask you. They need to learn to find information for themselves. Finally, highlight key points, clinical pearls, and takeaways. The sheer volume that students are required to learn, in addition to their novice level of learning, makes it difficult at times to determine what information is most critical. Once you've finalized your materials, please submit them directly to the course director at least 2 weeks in advance of your lecture or activity. Materials will be reviewed by the course director, who will contact you with any questions or feedback. When you arrive to our campus, a faculty or staff member will greet you and ensure that you're set up and ready to go in the classroom at your scheduled time. As always, please contact the program for questions or support. We're here to make sure that your experience is rewarding and exciting. As always, thank you for your support of our program and the next generation of Nevada PAs, and welcome to the team.